Imagine this. You book a doctor's appointment on your phone, your smartwatch spots an irregular heartbeat before you feel anything, and your test results show up in an app before you even get home.
That sounds futuristic, but for millions of people, it's already normal. The surprising part is who's driving it. Not just hospitals, not just clinics. Some of the world's biggest technology companies are moving into healthcare.
Today, we're unpacking how big tech is changing healthcare, why it matters, and what it could mean for patients, doctors, privacy, and trust.
Welcome back. I'm Pof.
And I'm Dr. Nova. This is the show where we break down big global shifts in a simple, practical way.
Today's topic affects pretty much everyone because sooner or later, all of us become patients.
And healthcare is no longer just about hospitals, doctors, and pharmacies. It's now also about apps, data, cloud systems, wearable devices, online consultations, and artificial intelligence.
In this episode, we'll explore how large technology firms are entering medical services, what benefits they bring, where the risks are, and what patients should pay attention to.
And to keep things grounded, we'll use one running example throughout the episode, a busy working parent trying to manage their family's healthcare.
Let's start with the obvious question. Why is big tech interested in healthcare at all?
Because healthcare is enormous, complicated, and still surprisingly inefficient in many places.
A lot of health systems still deal with paperwork, slow appointments, disconnected records.
Billing confusion and long waiting times.
And technology companies look at that and think, we can simplify this.
From their point of view, healthcare has the same ingredients that transformed other industries.
Huge amounts of data, lots of friction, and plenty of room for digital tools.
Think about what tech companies already do well: organizing information, building user-friendly apps, running cloud systems, handling online payments, and developing AI tools.
Now imagine all of that being applied to medical appointments, prescriptions, health records, diagnostics, and remote monitoring.
That's why healthcare has become such a big target.
When people hear big tech in healthcare, they often imagine robot doctors.
Which makes a good movie poster, but that's not really the main story.
The real story is much more practical. Big technology firms are entering healthcare through several doors.
First, telehealth and online care platforms.
Second, wearable health devices like smartwatches and fitness trackers.
Third, cloud systems that store and organize health information.
Fourth, AI tools that help analyze images, symptoms, and patient data.
And fifth, pharmacy, prescription, and digital health service platforms.
Let's go back to our running example. Imagine a parent named Priya managing healthcare for herself, her partner, and 2 kids.
Instead of calling multiple clinics, repeating the same information over and over, and keeping paper test results in a drawer somewhere, she can now do much of it through apps.
She books appointments online, receives reminders by text, stores scripts digitally, checks lab reports in a portal, and tracks health alerts from wearable devices.
From the patient side, that feels smoother, faster, and far less stressful.
Let's be fair, there are real benefits here.
Definitely. The first one is convenience.
A lot of people don't want to take half a day off work just to renew a prescription or ask a doctor a simple follow-up question.
Telehealth changed that. Now, in many cases, a patient can speak to a doctor from home.
The second benefit is speed.
Digital systems can reduce delays. Booking, referrals, results, and communication can move faster when the system is connected.
The third benefit is access.
This is especially important in rural or remote areas. In Australia, for example, distance can be a real barrier.
Digital healthcare tools can make specialist advice more reachable.
The same applies in parts of Africa, India, and Latin America, where physical access to clinics may be harder, but mobile phone access is growing.
The fourth benefit is early detection.
Wearables can sometimes spot warning signs before a patient notices symptoms. That doesn't mean your watch is a doctor, but it can act like an early signal.
And for parents like Priya, that means fewer things slipping through the cracks. This isn't just about patients, it also changes work inside the healthcare system.
Doctors and nurses spend a huge amount of time on admin: notes, records, scheduling, documentation, follow-up, compliance.
In many places, clinicians complain they spend almost as much time managing systems as treating people.
So when technology works well, it can reduce repetitive admin and free up more time for actual care.
Hospitals also benefit from better coordination.
If records are connected, a patient doesn't need to repeat their entire medical history every time they move between providers.
AI tools can also support decision-making.
For example, an imaging tool might help flag something unusual in an X-ray or scan, so a radiologist can review it faster.
That doesn't replace the doctor.
Right. It helps the doctor focus their attention where it's most needed.
It's more like a second set of eyes than a replacement brain.
Now we need to talk about the uncomfortable part.
Health data.
Exactly, because health information is among the most sensitive information a person has.
Your search history is one thing. Your blood test results, fertility treatment, mental health history, medications, and chronic conditions are something else entirely.
And here's the concern. Technology companies are very good at collecting data.
That's their business model in many areas.
So when those same companies move into healthcare, people naturally ask, who owns the data? Who can access it? How is it being used? Can it be sold? Can it be shared? Can it be hacked?
Patients want convenience, but they also want trust.
And healthcare runs on trust. If patients fear their information may be misused, they may become less honest with providers.
Which is a real problem because good care depends on accurate information.
So yes, digital healthcare can improve lives, but if privacy protections are weak, it can also create serious risks.
There's another issue here that often gets ignored.
The human side.
Healthcare is not just about efficiency.
It's also about reassurance, empathy, listening, and human judgment.
A parent with a sick child doesn't just want an algorithm, they want calm guidance.
An elderly patient may need patience and emotional support, not just a digital check-in form.
And someone facing serious illness usually wants eye contact, compassion, and conversation.
This is where big tech can sometimes misunderstand healthcare.
Because in healthcare, being fast is helpful, but being human is essential.
So the best systems won't remove people, they'll use technology to support people.
Let's take this around the world.
In the United States, technology is deeply shaping healthcare through telehealth platforms, wearable devices, digital patient portals, online pharmacy services, and AI tools for clinical workflows.
In Europe, digital health records and connected systems are becoming more common, helping providers coordinate care across different services.
In Australia, telehealth has been especially useful for regional and remote communities, where distance makes in-person access harder.
In India, mobile-first healthcare is a huge story. Many people access services through smartphones, from consultations to prescriptions to diagnostic support.
In China, health super app ecosystems have made digital booking, payments, and health services part of daily life in urban areas.
In the Middle East, large investments in smart hospitals and digital health platforms are helping modernize services quickly.
In Africa, mobile health tools are helping bridge gaps where traditional infrastructure is limited.
And in Latin America, digital health startups are improving access to consultations, scheduling, and medication delivery.
Different regions are moving at different speeds, but the direction is clear.
Healthcare is becoming more digital everywhere.
So, who benefits most from this shift?
Patients can benefit through access and convenience.
Doctors can benefit through better tools and less admin.
Hospitals can benefit through efficiency.
Tech firms benefit because healthcare is a massive market.
But risks remain.
Over-dependence on platforms.
Data concentration.
Unequal access for people who are not digitally confident.
And the danger of turning patients into data points rather than people.
Another unanswered question is accountability.
If an AI tool makes a wrong suggestion, who is responsible?
The doctor? The hospital? The software company?
These questions matter more and more as tech moves deeper into healthcare.
Let's make this very real.
A working parent in Melbourne uses telehealth for a child's mild illness, gets advice quickly, avoids a long clinic wait, and receives a digital prescription the same day.
Example 2. A man in California receives an alert from his smartwatch about an irregular rhythm. He follows up, sees a doctor, and gets early treatment.
Example 3. A woman in rural India speaks to a doctor through a mobile platform instead of traveling hours to a city hospital.
Example 4. A hospital in Europe uses a digital record system, so a patient moving between departments doesn't need to repeat the same story 4 times.
An elderly patient struggles with a digital-only system and still depends on family members to navigate healthcare access.
That last example matters.
Because not everyone experiences digital healthcare as empowerment.
For some people, it can also feel confusing or exclusionary.
So, where's this going next?
Healthcare will likely become more predictive, more personalized, and more digital.
We'll probably see better remote monitoring, smarter scheduling, more AI-assisted diagnostics, and stronger integration between home devices and medical services.
Preventative care may improve because systems can spot patterns earlier.
Patients may get nudges before things become serious.
But the future won't simply be tech takes over healthcare.
The real future is more likely to be a mix.
Technology handles routine, admin-heavy, or data-heavy tasks.
Humans focus on care, judgment, ethics, empathy, and trust.
The winners will probably be the systems that combine both well. Let's bring it together.
Big tech is entering healthcare because the industry is huge, complex, and full of inefficiencies.
Technology is already improving convenience, speed, access, and coordination for many patients.
It's also helping doctors and hospitals handle data and workflows more effectively.
But it brings serious questions about privacy, trust, accountability, and the human side of care.
In short, this shift could make healthcare better.
But only if patients remain protected and people remain at the center.
Thanks for listening.
If this episode made you think differently about the future of medicine, share it with someone who works in healthcare, uses health apps, or just loves understanding where the world is heading.
And tell us this, would you trust a tech company with your health data if it made your care faster and easier?
Subscribe for more smart, practical conversations about technology, money, society, and everyday life.
Until next time, stay curious, stay informed, and take care of yourself.